Podiatrists are using the latest state-of-the-art technology to treat a growing problem with today's population, and early results are promising. Dr. Victoria Foley discusses the new microvasc therapy, which has proven effective.
People who have diabetes over a long period of time have high sugars that are going up and down. And with the high sugars, the nerves can't work properly. They can't send the signal to the muscle or the skin so that the muscles work properly or that you can feel properly. Over time, you either have numbness, burning, or electrical shooting pain. Before the microvasc machine, all I could do was treat the symptoms. So if you had peripheral neuropathy and you had burning pain, there was medications I could give and creams. You could soak your feet to increase the circulation. But now with microvasc, I can treat the patients and reverse the peripheral neuropathy symptoms. People that are inclined to get an ulcer will have diabetes and they'll have a callus or a corn. And then that callus and corn, they'll keep walking on the same spot. If you or I had a callus or corn, we would stop because it would hurt. It doesn't hurt, so they keep walking on it, and then it starts to bleed and break down inside and become an open sore or an ulcer. Microvasc is an electrical stimulation machine. What it does is there's 16 electrodes that are attached to both legs. They're attached to your thighs, your calves, your ankles, and your feet. When the electrical stimulation machine or microvasc starts, you start to feel tingling. When it is increased, then the muscles start to contract. When the muscles contract, increases the circulation, what we call the collateral circulation, so that there's more oxygen. Also, when the electrical stimulation happens, it stimulates the nerves, so the nerves get impulses they haven't had in years, and they start to grow and heal.
The microvasc therapy is a non-invasive method of treating a patient, providing permanent results. Microvasc is being received tremendously by podiatrists no matter where we go. We've got between 200 and 300 users domestically now, but just recently have come out west to California with it, Dr. Foley being the first in the area. This is an example of a ulceration that is called non-healing. A non-healing ulcer basically is one that the doctors will throw everything they can at it. They can't close the wound, and the only remedy then becomes amputation. What you see here is a picture of a before. This patient was actually scheduled for amputation. You know, one last-ditch effort, throw the microvasc on the patient, and 30 days later you see it almost healed, and then 60 days later it was completely healed. That was actually 51 treatments over 60 days.
Patients come in 3 times a week, and the treatments are 45 minutes long. Microvasc is excellent for treating sports injuries, postoperative swelling, and postoperative pain. Microvasc also treats a condition called plantar fasciitis, which is very common. This is a problem where you have heel pain, and people will wake up in the morning and their heel hurts. They walk a little bit, and it hurts at the end of the day. And this treats that condition non-invasively. Very successful. I've had patients tell me they can feel the floor again. I'm having patients, diabetics with ulcers that are healing. They're also being able to walk. They weren't able to walk. Their families tell me their grandmothers would just walk around the house. Now they want to go for walks to the park, be with the grandchildren. They're much happier. They're living a fully functional life without taking medication.